Congratulations on entering your 9th and last month of pregnancy. At this point, your baby is almost ready to be born. He or she only needs to grow a little bit more before being placed in your arms. At week 36, your baby weight is around 5.8 pounds and about 18 to 19 inches. Even though there are more differences in a baby's height and weight as the due date gets closer, your baby's size at week 36 is similar to a papaya. Except for the digestive system, your baby's development is almost done by 36 weeks. The digestive tract is not fully grown until the baby is between 1 and 2 years old. They lose the downy hair that covers their skin, called lanugo, into the amniotic fluid at this time. Their first stool, called meconium, is forming and will come out after they are born, unless there is any distress during delivery. At 36 weeks, you may have noticed a better breathing. As your baby's head moves down into the lower part of your uterus, more room is made for the lungs, which makes breathing easier. This is commonly called lightening. Vaginal pressure. The baby's weight on the lower part of the uterus puts a lot of pressure on the vagina, making some women feel like they have a bowling ball in between their legs. Braxton Hicks contractions. Small contractions that come and go are just your body getting ready for the big day. If it gets more frequent and worse, call your midwife. Week 37. Your baby can come at any time between weeks 37 and 42 and not be considered premature but rather full term. This week, your baby's average length is 19.1 inches, 48.5 centimeters, and he weighs around 6.3 pounds, 2.8 kilograms. At week 37, your baby is the size of a romaine lettuce head. At 37 weeks, you may have Braxton Hicks contractions, a tight abdomen, and vaginal discharge. You may find it hard to sleep at this time because you are generally uncomfortable, have to go to the bathroom a lot, or are anxious. Light exercise, a good body pillow, drinking more water in the morning, and less in the evening are all important things to do. 38 weeks. At 38 weeks, your baby is about 19 to 20 inches long, weighs 6 to 7 pounds on average, and is about the size of a bunch of leeks. In the last weeks of your pregnancy, your baby's brain, lungs, and liver continue to grow and change. During week 38, you may have a mucus plug, more vaginal discharge, fatigue, trouble sleeping, indigestion, and a feeling of being hot and overheated. It is important to eat healthy foods and drink enough water. 39 weeks. You just can't wait to have the baby at this point. At week 39, your baby is about the size of a small watermelon. It measures between 18 and 20.5 inches and weighs between 6.5 and 8 pounds, 2.9, 3.6 kilogram. You may feel tired, have pressure in your pelvic area, and cramp at this time. To get ready for the hard work of giving birth, don't forget to do some light exercise. 40 weeks. You've now carried and fed your child for 9 months. With your help, the baby can now survive outside the womb. Your child is about the size of a small pumpkin, weighs around 3 to 4 kilograms, and is between 19 and 21 inches long. Except for the skull, your baby's bones have hardened enough by this week to make vaginal birth easier. This week, you might have effacement, which causes the cervix to open, along with pelvic pain, diarrhea, and discomfort. If you aren't in labor by 40 weeks, your doctor or midwife will decide if you need to be induced. Please tell us the symptoms you've had so far and the exact number of weeks you've been pregnant. Thanks for your time. Please subscribe if you liked this video so that you can see more.